Anna is having difficulty breathing. She is feeling some heart pressure near her lungs. She went to the hospital and was diagnosed with an infection in her respiratory tract. In this video, we will be learning about some disorders associated with the respiratory system. If you find someone with difficulty in breathing, wheezing, breathing through the mouth, or showing fast breathing, then these can be the symptoms of asthma. It is a chronic long-term condition and occurs due to several environmental factors such as allergies to pollen and dust, animal fur or feathers, smoke, fumes, etc. Inflammation in the airways, which leads to the difficulty in breathing, characterizes this illness. More specifically, asthma is due to the inflammation of bronchi and bronchioles. This condition is treated according to the level of infection in the infected persons. Spirometry, challenge test, peak flow meter tests and exhaled nitric oxide test are few lung function tests that help to determine asthma. Next, we will discuss emphysema. It is a chronic condition that affects the lungs' tiny air sacs or alveoli. Recall that it is through the alveolar walls of the lungs that oxygen and carbon dioxide are transferred or interchanged. So, emphysema causes the alveoli to expand abnormally, thus decreasing the respiratory surface, weakening the walls and making breathing more difficult. Do you know who will be affected? People have the habit of smoking tobacco for a prolonged time, air pollution and fumes, and people exposed to inhaling asbestos are also prone to this condition. Have you seen people working with asbestos sheets, sprays of varnish, paints and acid, farmers using pesticides, and industrial workers with exposure to dust from cotton, silica, coal, and drug powders? All are prone to occupational respiratory disorders. Occupational respiratory disease are conditions that develop as a result of exposure to pollutants and toxins. Upon long exposure to this condition, the proliferation of the fibrous tissues happens, which leads to the fibrosis, which in turn develops lung damage. Pulmonary fibrosis thickens and scars the tissues surrounding and between your lungs, air sacs or the alveoli. For occupational lung disorders, there are no cure. Your quality of life can be improved by limiting your exposure to lung irritants, thus delaying the development of the disease. Avoiding the inhaled chemicals that cause lung diseases is the greatest way to prevent occupational lung disorders. Each individual should take care of themselves to prevent respiratory tract disorders. So now, let us summarize what we have learned.
Manorama Horizon. Learning made simple.